Hi, good morning, everyone. How are you guys? Good morning. Are you able to hear me?
Good morning, sir.
Good morning. Good morning. Okay, so guys, let's start. It's 11:05. We should not wait much. We have waited for 5 minutes. Okay, before starting this induction class, guys, first let me know about you. I mean, it's not possible to go for the introduction of everyone, but I would definitely like to know how many of you are from the past batch of ECG course? Yes, please raise your hand or write yes. How many of you are from the past batch of ECG course? Anyone? Who is from the past batch? Who is from the ECG master's course here? Anyone? No one. Who has attended my cardio series 2? Cardio master's course series 2? Arrhythmia. Who has attended that? Anyone of you? Yes, guys, please reply. No, very less number. I mean, only one. Okay. So tell me, how many of you are new to this class and not attended the ECG course before, or not attended the arrhythmia course before from CLIMAT? Please raise your hand, guys, or just write new. You can write new. Yes. Okay. So almost all are new. Cool. Yes. Right. Right, guys. Now you can. Okay. So we have to start from the very basics, right? No worries. So today is the introduction class and induction of this course. So I would like to thank you for joining this course. This course is introductory certificate course in ECG interpretations. And see, we have already conducted the ECG master's course. Okay, before from October to January, and in past few months we have conducted one of the biggest course in ECG, that was ECG master's course. But that was not exactly what we say the basics, because that was designed for you people with some advancements. Okay, so some advanced we have covered the syllabus of MDs and DM also, and we have covered the ECG interpretations for all the diseases, right? And that cases and course was taken by Dr. Harnis Bhatia, Dr. Prabhu, and Dr. Sudhakar, and many other people, right? So that course was kind of advanced version of the ECG programming, right? ECG interpretations. And in that, half of the population, I'll say there were 850 registrations in that course. So half of the population was not able to pass the exam. Okay, because they were not attending the classes, and many of them left the course in between, right? Why? Because it was kind of typical. They did not attend, and they were just believing in the recordings. I always tell in my courses why we are pro in the courses, because we conduct all the classes live, 100% classes live, so you can interact with the mentor and you can ask your queries direct to the mentors. But you guys don't listen to me sometimes, and you are like, no, we'll not attend the classes, we'll just take care of the class from the recordings. And today also I can see there is only 40% people who are joining the class. There are 250 people who have joined the course, and only 58 except me have joined this today's class. Okay, so guys, please be in the classes, then only you can understand. ECG is not something which is very easy to understand or very easy to interpret. Okay, See, I have made this course very basics. Very basics means like uh, it is just the initial part of the ECGs. Why it is? Why I came up with this course when we have already done the basics to advanced version of the course? Why we have come up with this introductory course? Because many of you have left the course before and you guys were not able to understand the things. I don't know what was the reason, because our mentors, our course was perfectly fine, and around 400 people passed the exam and they got the certificate also, and it was really good, right? But I thought like you people need one of the basic things, very basic things. So I came up with this course where I'll be teaching you from the scratch, okay, and the basic part of the ECGs, right? So let me just share. You must have gone through the brochure. This is the brochure, right, guys? This is the brochure you must have gone through. So introductory course in ECG interpretations. So this is the course which is rebooted or curated for the beginners to understand the basics. This is for the beginners. I'll not say this is the advanced version of the course, or this is the, here you will see the different ECGs in different diseases, or different ECGs in metabolic syndromes and all. Not at all. Okay, this is like you will just understand, and you must have seen the course coverage also. But I'll make you expert of ECGs at basic level, so you can easily understand what exactly the ECG is and how to read it. Okay, how to read it. You may not be able to interpret the typical uh, diseases out of the ECG, but you will be at least interpreting what is tachycardia, what is bradycardia, what are other arrhythmias, what is myocardial infarction, and what are the changes in vulnerable populations, that you are going to understand. So as you can see, we will be teaching you the ECG physiology of involved in the ECG, then ECG leads and their placements, indications for the ECG monitoring, and heart rate estimating through the ECG, and ECG interpretations in a simple way for tachycardia, arrhythmias, and myocardial infarction, and in the vulnerable population. So as today is the induction class, I'll be teaching you today. I'll be teaching you heart and the conduction system. Okay, heart and the conduction system. So that is the foundation for the ECG course. Like you can easily understand how the ECG are being generated, ECG impulses are being generated, right? And every Friday classes will be there from 7 to 8 30 p.m. So first class is today. I'm not just ending with the induction or introduction, or with just interaction with you. I'm here to teach you also today. Okay, and then at the end, definitely certificate will be given, but with the exam, and everyone has to clear the exam with 60% of the marks. I got a lot of complaints in the past course also, that sir, we are not able to get the certificate because we did not give the exam, or we did not pass the exam. See guys, ECG is a critical thing. Okay, ECG is a critical thing. Why it is? Because if you are working in the healthcare system like hospitals, and someone comes to you with the ECG, or maybe you getting a job in the hospital or somewhere with my certificate of ECG, and you don't know anything, then you are playing with the lives, right? So remember these things from the first class, from the today itself. Remember this thing: I will not give you the certificate until and unless you are not passing the exam with 60% marks. Okay, be careful. This is I'm stating in the induction class only. I will not listen to any kind of complaints again. At the end of this course, that sir, I want the certificate. It's very important for me. I paid the fees and all. I really don't mind at all. Okay, because this certificate, if you are getting, and if you are going somewhere, submitting, getting the job, and if you don't know about ECG, you must be playing with the lives. Okay, so this is something very practical, and I'm not going to give you the certificate at all if you are not attending the classes, not giving the exam and passing the exam. Okay, so this is my open warning to all of you. But definitely all the classes, if you are attending, you will pass the exams with at least 80%. I'm very sure. Attend all the classes, come to the classes, learn from me. Whatever questions you have, please ask me. Okay, so many of you are new here? Sir, I'm not able to hear your voice. Is it? Guys, can you hear my voice?
Yes, sir, we can hear you.
Okay, someone is writing. Shreyas is writing, sir, I'm not able to hear your voice. Please check your network, Shreyas. Okay, please check your network. Okay, so let me share the screen, guys, and let's start. Let's start with the interactive session because this is something really, really, important and very basic, right? So just confirm people if my slides are visible in the full screen mode. Okay, can you see the slides in the full screen mode, guys?
Yes.
Great, perfect, perfect, perfect. Okay, so today we are going to talk about the heart, the conduction system, and not electrocardiogram. I thought to teach you the electrocardiogram basics also today, but when I looked at the slides, there are too much things to discuss today, and Shreyas, I think that is the problem with your network. Then please check it. Okay, so heart, conduction system, and electrocardiogram, the ECG. I'll not be teaching you, but I'll be showing you. Okay, so let's start. Guys, tell me how many of you know the anatomy of heart? How many of you know the anatomy of heart? And can you tell me what are the components or the parts of the heart? And no, you have to write or speak or tell me that how the blood flow works in the heart, the right flow of the blood, sequential blood flow. Can someone tell me? Do we get the study material for the same? We will be sharing some ECG reading techniques with you, some documents definitely I'll be sharing, but there is no specific material because I usually teach in the very few slides, 4 5 slides, and that is also the pictures. I don't keep the theory much in the classes, right? So there is no specific material, but yes, you will be getting the recordings of the classes, so you can learn whenever you want after the class also. Okay. Yes, so tell me, guys. My question here is, the sorry, anatomy of heart. Anatomy of heart. Please tell me what is the anatomy of heart. How many components are there? How many parts? So this is basic. You must know that, right? And what is the blood flow sequence? Yeah. Yes, guys. How many parts? Not layers. Okay. It consists two auricles, ventricles, atriums, and ventricles. Okay. Yes. Left and right atria, left and right ventricles. Absolutely. Left and right ventricle, left and right atrium. Yes. Supplied by the coronary artery. Absolutely. Yes. Aorta. Aorta is the major artery in the body which supplies the blood to the entire body and takes the blood from the heart. Right. Left atrium. Okay. Okay. She looks like our expert. LA, LV, RV, RA, aorta, SVC, IVC, MV, TV. Okay. People will not understand those things, but I'll tell them. Okay. AV node, SA node, Purkinje's fiber. This is not circulation system. Okay. When I talk about blood flow sequentials, that is circulation system. So what you are writing here, AV node, SA node, Purkinje's fiber, that is not circulation system, right? Okay, let me take you to the slide. See, this is the heart. Okay, this is the heart, and usually it starts from, we usually say that it starts from right atrium. Okay, this is the number one thing, right atrium. Why it is the what we say, we start from the right atrium always, because this is the part of the heart where we get all the deoxygenated blood. Okay, the vena cava, inferior vena cava and superior vena cava, they open, both superior vena cava and inferior vena cava open into the right atrium. This is the first chamber of the heart. Okay, this is the first chamber of the heart, right atrium. Okay, and it collects all the deoxygenated blood from the body through the superior vena cava and inferior vena cava, or we say combinedly, collectively, it is vena cava. Vena cava means the largest vein in the body. Okay, largest vein of the venous system in the body. Venous system means like which is collecting the deoxygenated blood from the different organs and different parts of the body, right guys? So like whenever it collects, it carries always, if I'm talking about vena cava or veins, these are carrying the deoxygenated blood. Okay, and this deoxygenated blood from right atrium, this is the right atrium, right, it goes to the right ventricle. Okay, it goes to the right ventricle. This is the, this shape is the right ventricle, this entire thing is the right ventricle. Okay, this is the right ventricle. So again, from the right atrium and right ventricle, this will be deoxygenated blood. I'll just write here component, this is the chamber 2. So here deoxygenated blood, deoxygenated blood. Okay, this is deoxygenated blood where I mean it has taken, you know, all the blood which is deoxygenated. And now the third thing here is, in this, the third thing here is blood from the right ventricle. Okay, okay, first let's understand this. From when it goes to, you know, right ventricle from the right atrium, it goes through the, this part, this is the septum between right atrium, septum means the wall. Okay, this is the wall between right atrium and right ventricle, and here is an opening. Okay, here is an opening between right atrium and right ventricle. This is called as right AV valve. AV means atrioventricular. Okay, atrioventricular valve. Atrioventricular means atrium and ventricle, the between the valve between the atrium and ventricle. So atrioventricular, right AV valve. And this is also known as tricuspid valve. Tricuspid valve, why it is tricuspid valve? Because the valve is like this. Okay, there are three cuspids, there are three cuspids, 1 2 3. So whenever it opens, it has three flaps. Okay, like in our window sometimes we have two flaps, the one flap, so it has three flaps. Okay, this is called as tricuspid valve. Okay, so whenever the blood goes, understand the physiology, whenever the blood goes from right atrium to left atrium, it opens to this side. Okay, and whenever the blood flow stops, it closes. Okay, it closes, the valve closes here. Okay, and stops the reverse blood flow. Okay, it stops the reverse blood flow to the right atrium. Understand? So this is tricuspid valve between right atrium and left atrium. Another, you know, AV valve, another atrioventricular valve is left side, I'll come to that. That is mitral. Okay, that is also known as mitral valve, and that is not tricuspid, that is just bicuspid. Okay, that is not tricuspid, that is just bicuspid. Bicuspid means, here look at this, only two flaps are there, 1 and 2. Okay, only 1 and 2, this is bicuspid, right? This is not tricuspid. Understand? Whenever it you know, like there's a valve between left atrium, this is the left atrium here, and this is the left ventricle. Okay, this is the left ventricle here. So this is the chamber number 3, this is the chamber number 4. Now I'll come to the you know, flow, right? So from the right atrium, blood goes to the right ventricle through the right AV valve or tricuspid valve, and from here, and from here it goes to the lungs for the purification. Lungs for the purification. Okay, lungs, how it goes from the right ventricle, right ventricle pumps the blood into the pulmonary arteries. Okay, pulmonary arteries. So like there are two lungs we have on the right side and left side, so there are two different, you know, pulmonary arteries, two branches of pulmonary arteries, right? So this is right pulmonary, this is left pulmonary artery taking the blood to left lung. And here if you see, this is the right pulmonary artery, this is the right pulmonary artery taking the blood to the right lung. Okay, and here is the contraindication. Okay, here is the contradiction. Contradiction is what? Because see, usually we say when we talk about veins, this is like deoxygenated blood, sorry, deoxygenated blood, right? And when we talk about artery, this is oxygenated blood, right? But here, after the heart to lung and lung to heart, this is just ulta, because the veins here, the blood goes to the lungs through the arteries. Okay, and that is deoxygenated blood. And from the lungs, blood comes to the heart through the pulmonary veins, and that is the oxygenated blood. Okay, I'll tell you here again. See, from right atrium to left right ventricle, from right ventricle to it goes to the lungs from the pulmonary arteries. Why we call them arteries when these are taking the deoxygenated blood? Why we call them arteries when these are taking the or carrying the deoxygenated blood? Why we are calling them arteries is because they are taking the blood away from the heart. Okay, whatever vein, whatever capillaries, okay, either large or small, whatever capillaries they take the blood out of the heart are called as arteries, and whichever capillaries taking the blood back to the heart are called as veins. Okay, that is very simple. The blood capillaries are the capillaries inside the body carrying the blood into the heart are called as veins, and which are taking the blood from the away from the heart are called as arteries. But usually in the normal system, arteries are carrying the oxygenated blood to the entire body, right? But here, arteries are taking deoxygenated blood to the lungs. Only this is the exemption. Okay, this is the only contradiction or exemption where arteries are taking the deoxygenated blood to the lungs. Okay, so now let's come back to this. Now, from the right ventricle to the lungs, from the pulmonary arteries in the lungs here and this side, right and left side, the blood gets oxygenated, right? Blood gets oxygenated, blood, because it, leaves, the blood leaves the carbon dioxide here and collects the oxygen in the lungs, okay, from the alveoli, right? And then the blood comes back from the lungs, blood comes back to the heart from the left and right pulmonary veins. Why these are veins? Because these are collecting the blood from the outside and getting into the heart, right? Getting into the heart. But again, contradiction, these veins are the only veins in the body which collects the oxygenated blood, right? And carrying the oxygenated blood to the heart, where? Not to the right side, to the left side now. Left atrium. This is the left atrium. This part is left atrium. Okay, this part is left atrium. Let me just, uh, okay, so let me just, I'll show you this. Okay. Okay, so I'll just, okay, I'll just carry this so you can understand better. Yes, so I have deleted the old things. So this is the simple way I was telling, from the right A to right V ventricle, and then to the lungs, and from the lungs it comes to the segment 3. Okay, this is the segment 3, or what? Or right, sorry, the left atrium. Okay, if you see here, this is the left atrium, which is collecting the oxygenated blood from the lungs, both the lungs. Okay, from the right through the right pulmonary veins, from the left from the through the left pulmonary veins. Okay, left atrium is collecting the pure blood, and from the left atrium it goes to the left ventricle. This is the fourth chamber of the heart. This is the third chamber, fourth chamber of the heart, where blood goes from the left atrium to the left ventricle. Okay, this is the fourth and last chamber where blood stays in the purified phase, I mean the blood is purified here, oxygenated, and from here and from the left ventricle, blood will go to the entire body. Okay, blood will go to the entire body through the aorta, through the aorta. And aorta is again, here if you look at this, is having multiple branches, but this is the main artery or the largest artery of the body, okay, called aorta, right? So the purified blood from the left ventricle, it goes to the aorta, and from aorta, from the multiple branches, it goes to the different organs of the body and the entire body. This is the blood flow. And if you look at this side, see sequence of the blood flow. Blood enters in the heart from vena cava. It goes to the right atrium and then right ventricle, then through the right and left pulmonary artery to the lungs, and then from the lungs it comes back from the left and right pulmonary veins to the left atrium, and from left atrium to left ventricle, and from left ventricle to aorta, and then to the entire body, systemic circulation, right? So this is the proper blood flow, and this is the proper anatomy of heart, right? So this is mitral, this is tricuspid valve, and between left atrium and left ventricle, this is what? This is mitral valve, and I told you bicuspid. Okay, bicuspid, not tricuspid. Okay, and when the blood flows from the left ventricle to the aorta, there is like aortic valve. Okay, aortic valve, which creates the barrier, or which is the barrier between left ventricle and the aorta. Why? Because it stops the reverse flow of the blood from the aorta to left ventricle. Similarly, there are pulmonary valves. If you look at this place, this is pulmonary artery, and there is pulmonary valve. If you look at this is the pulmonary valve. So pulmonary valve will close when the blood goes into the pulmonary arteries, and it stops the reverse blood flow to the right ventricle. Okay guys, it stops the reverse blood flow to the right ventricle. So this is the exact anatomy of the heart. So you will now understand there are 4 chambers and how's the blood flow. Now along with that, let me tell you, see, this is the entire atrium, right atrium. Okay, and this is the atrial septum. This is the atrial septum, and this is the septum between somewhere. This is the septum between this is the septum between right atrium and the left atrium. Okay, right atrium and left atrium. This is the valve. So this is the wall of the heart. This is the wall of the heart, which helps in contraction and relaxation. This is the wall. Okay, there are 3 layers. Okay, and the cells of the our cells of the cardio muscles are like myocytes here. Myocytes, these are completely making the wall of the heart, and it has 3 types, 3 layers in the heart wall: myocardium, endocardium, and what else, guys? Can someone tell me the third one? See here, endocardium is the
Pericardium.
yes, innermost layer. Okay, innermost layer. If you look at this is the endocardium, innermost layer. Okay, and the second, the matrix, is known as myocardium, because these are the muscles here. Okay, and the last thing is pericardium. Pericardium means the outer layer of the heart. Okay, outer layer of the heart wall. Okay, outer layer of the heart wall. This is called as pericardium, and this matrix is called as myocardium, because there are the muscular system. This is the muscular system. These are the muscles, okay, which are making the wall of heart, and the inner layer is called as endocardium. Okay, now why I'm telling this? Because all the impulses, when we are going to the conduction system, the entire conduction system goes through these myocytes only. Okay, myocardium only, right? And these muscular part only helps circulating the impulses, right guys? So this will be helpful in understanding the next part. So here, cardiac conduction system, right? So cardiac conduction system is nothing but the network. Okay, this is the specialized network which is in the heart walls. As I told you, this is in the heart walls. Okay, conduction system is in the heart walls. Conduction system has two types of cell. One is conducting cells, like which carries the electric signals. Here, look at this. Two type of cell control. One is conduction cells, one is muscular cells. So conducting cells are carrying the signals. Okay, like these are suppose this is the one cell. Okay, this is the one nerve cell. Nerve. This is the second nerve. This is the third nerve. It goes right. So the impulses goes like this, from this to this and from this to this. Okay, like that. Okay, it goes like that, right? So yeah, so from like here to here, and then from here to here, and then from here to here, and the entire heart wall goes with the signals, and based on that only muscular cells, okay, they do the contraction or relaxation, whatever is necessary or whatever is commanded, whatever is instructed from the initial part. I'll come to the initial part also. The initial part is known as SA node, sinoatrial node, and that is also known as the pacemaker of the heart. Okay, pacemaker of the heart, permanent pacemaker of the heart. That is the natural pacemaker of the heart. Okay, so the system, cardiac conduction system, is like in the heart walls. The muscle cells send the signals to the rest of the heart muscle, causing the contraction. This group of muscle cell is also called as cardiac conduction system. So it usually has conducting cells and muscle cells, right? So the main part of system, conduction system, are SA node, AV node, bundle of His, bundle branches, and Purkinje's fiber. So let's learn this. Okay, this is the cardiac conduction system. This is the entire cardiac conduction system, guys. So the ECG is completely based on this. Now you understand what exactly the anatomy is, what exactly the blood flow is, and what exactly will be the conduction system. Okay, so there are five major parts. Okay, in cardiac conduction system there are five major parts. First is sinoatrial node. Okay, that is called as pacemaker of the heart also. So this generates the impulses. Okay, this generates the impulses, and this is okay. So let me take the different color here. So this is the sinoatrial node. Okay, and this is located, sinoatrial node is located at the apex of the apex of RA, right atrium. This is the apex of RA. Okay, this is the apex of RA. So this is in the wall only. This is in the septum of RA only. Okay, this is in the septum of RA only. Shreyas, you please try again. And if you are not able to listen, please join again and correct your networks. I hope it is not a problem with everyone. Guys, if you have the problem, please let me know. Is anyone else having the same problem? Not hearing properly? Okay, so I think everyone is clear with the voice. I hope. Suresh, please join again, or try the good network. Yeah. Okay, so see, this is the apex of RA. Okay, RA means this is right atrium. You just have seen in the anatomy. So this is the apex of RA, where the exactly this SA node is located. Okay, where exactly the SA node is located, right? And this is the pacemaker. We call it pacemaker. So it generates the impulses. Okay, SA node, not nodes, only one node. So SA node generates the impulses, right? Why it generates the impulses? Why it generates the impulses? Question here is, okay, why it generates the impulses? Can someone tell me? Can someone tell me why it generates the impulses? What are the reasons behind generating the impulses? Yes, guys. It generates the impulses. It generates the impulses because this is controlled by, because this is controlled by, no contraction. This is controlled by, sorry. This is controlled by parasympathetic system. Okay, parasympathetic system. our sympathetic system, sympathetic nervous system. Okay, sympathetic nervous system. And sympathetic nervous system works based on the body's need, right? So sympathetic nervous system works with the body's need, whatever is needed to the body. Maybe suppose what exactly is the needed, why we have the heartbeats. So heartbeats are controlled, heartbeats are controlled by our sympathetic nervous system, or sympathetic the parasympathetic nervous system, right? So how it goes, it goes with the it goes with the hemodynamics of the body. So it needs, this is the need, and the need generates the impulses to the sympathetic nervous system, and sympathetic nervous system controls the sinoatrial node. Okay, and this sinoatrial node controls with the sympathetic nervous system. Okay, and based on that only it generates the impulses, and those impulses goes to the further parts. I'll come to that. Now before we go to the further parts, let's understand, see, why this coffee, you consume the coffee, most of you consume the coffee, I consume the coffee, many people consume the coffee. So immediately after consumption of coffee, why your heart rate goes high, right? Because it activates the sympathetic nervous system, and just raising in the sympathetic nervous system activation, it impacts the sinoatrial node. Okay, so when you are sleeping, okay, there are multiple factors, like daily life factors, daily life lifestyle related factors, or the whatever you are consuming, tea, coffee, or maybe the people who are taking the drugs or illicit drugs, or multiple things, antipsychotic drugs. So it depends. See, whenever you are sleeping, your heartbeat is low, right? Whenever you are running, your heartbeat is high, because of the hormones in the body. Those just activate, or relax the sympathetic nervous system. So sympathetic nervous system works on your body's activity and your lifestyle and your dietary part, whatever you are eating, based on that. And the hormones are getting balanced or imbalanced, or rising in the levels. If they are rising in the levels, sympathetic nervous system will be activated highly. And similarly, when sympathetic nervous system is activated highly, the nerves will directly lead to the SA node, and your SA node will be activated much more, and it will be creating the impulses faster. Okay, it will be creating the impulses faster, and your heartbeat will be faster. During the sleep, the sympathetic nervous system will be slow, exactly. And when it is slow, the SA node automatically will be slow, right? So this SA node controls your heartbeat, and this is controlled by the sympathetic nervous system. And sympathetic nervous system is automatic thing which is controlled by your daily activities, your diet, your food, or whatever you are consuming, or whatever you are doing. Okay, so that's how it works. So first component here in the conduction system is sinoatrial node, which is also known as the pacemaker. Okay, so now this pacemaker generates the impulses. You can see these are the impulses. Okay, you can see these are the impulses going to all the parts, also here from the right atrium to the left atrium, also here from the sinoatrial node to the entire atrium also. Okay, entire atrium also. So look at this, try to understand, guys, what I'm saying here, very important. So when these impulses are generated, these are circulating inside the atrium, right atrium. These are circulating. Okay, this is the clockwise circulation. Okay, this is the clockwise circulation. These are just rotating inside the septum of atrium, right atrium. Okay, and majority of that, usually these are circulating, but majority of the impulses are caught by the AV node. Okay, caught by the AV node. This is the AV node. Okay, let me clear it. How to delete it? I think I did not make the settings of that. Okay. I just did not make the correct settings. No worries. So see, the majority of, or the maximum percentage of the arterial nodes while circulating, see this arrow is going here directly, but this is not the way. These are circulating clockwise in the right atrium, and most of them are absorbed here. Most of them are absorbed by the AV node, that is called as atrioventricular node. So this atrioventricular node is located just opposite to the SA node. Opposite means in the one chamber only. Like suppose there is a one room, you are at the one corner, and the another person like SA node is in the corner, one corner, and AV node are in the like AV node is in the opposite corner, right? So in the same room but opposite corner, opposite septum. Okay, so majority of the impulses are gathered or controlled or get these are the majority of the impulses, these are absorbed by the AV node, atrioventricular node. So I mean, this is a fraction of second, not only 0.1 second. This is like 0.001 second task from here to here and absorbing the entire impulses. But when this is absorbing the impulses, after absorption of the impulses which are coming from the sinoatrial node, this AV node, take a pause of 0.1 second. Take a pause of 0.1 second, and then it transfer these impulses to the entire heart. Okay, entire heart, right? So here you can see the impulses pauses 0.01 second at the AV node, and then it goes to the further system. So simple, from the from the SA node to AV node, from the SA node to AV node, and from the AV node to the system. Okay, what is the system after AV node? There is the atrioventricular bundle. Okay, atrioventricular bundle is nothing but it is the septum of atrium and the, see, this is the septum of atrium and ventricular. Even the AV node is also located at the septum of AV. This is like atrium and ventricular, but inside the atrium. Okay, but inside the atrium, this is not the capsule which you can see in the atrium. This is in the septum only. Inside the septum only there is a simple node type of thing which is absorbing all the signals. And now from here, this all is going to the entire system. Entire system starts with atrioventricular bundle. Bundle means the bundle of nerves, bundle of muscles. Okay, bundle of nerves. So these nerve cells, are creating the bundle which is called as atrioventricular bundle and connecting the AV node. Okay, it goes till the mid of the ventricular septums. Okay, ventricular septums means what? Ventricular septums means the septum between RV and septum between LV. Okay, so right ventricular and left ventricular, this is the ventricular septum. This is called as the ventricular septum. Interventricular septum, you can see this is the entire interventricular septum, right? So here this system starts what we say, starts separating into the left and right side. Okay, so till here it was just atrioventricular bundle, the big bundle of the branches, with which big bundle of the nerves. And from here, these nerve cells, differentiating into the bundles which is going to the right side, and the bundles of the nerves which is going to the left side. Okay, which is going to the left side. So the right side bundle is called as the right bundle branch, and the left side is called as the left bundle branch. Right bundle branch. So here is again the bundle branches conducts the impulses through the intraventricular septum. So now the impulses are from here, they are going to the different sides, like to the right side and the left side, right? Now, and these parts or this differentiation here is calling the bundle branches. Right bundle branches which are carrying the conduction to or impulses to the right side, and left bundle branch which are carrying the impulses to the left side. Now at the wall of the heart, or the thickest septum of the left ventricle and right ventricle, this is the right ventricle, this is the left ventricle. So thickest wall, we can say, or thickest septum of the ventricles, it has again multiple branches from these bundle branches. Okay, these bundle branches are again differentiated into different muscular parts of the left side and right side, right? So this is called as the final differentiation of the nerves is called as Purkinje's fibers. Okay, there are small fibers which are coming out from the bundle branches, and that is called as Purkinje's fiber. This is the end of the conduction system. This is the end of the conduction system. So what happens is, now let's understand how it flows, how the impulses flows. SA node to the AV node to the AV bundle to the left and right bundle branches, and to the from here to the Purkinje's fibers in the right side and left side. And now here in the muscles, in the cardiac wall muscles, these Purkinje's fibers having the impulses, and these impulses in the muscular cells, myocytes here, in the myocytes here, what they does, they control the contraction. They control the contraction and relaxation. That's how the heart beats. That's how the heart beats, and that's how you get the heartbeats, and that's how the blood flows. Whenever there is a contraction in the right side, the blood goes from the RA to RV, and from RV to lungs. Okay, and then it will relax. Now when it relax, there is a again, now it is the process, the friction of seconds. Again, the blood is getting oxygenated in the lungs, and then again it comes to the, in the relaxation phase, it comes to the right ventricle from the left ventricle from the left atrium, right? And then again the cycle is going on. And why it is going on and how it is going on? Because these impulses are working through the entire conduction system. So then left ventricle contracts. Okay, when the left ventricle contracts, the entire blood pumps out to the aorta, and it goes to the body parts, it goes to the circulation system. That's how the conduction system works. And ECG means whenever we are gathering the information, whenever we are gathering the information of these impulses and creating the waves out of these impulses, because there is a frequency of impulses. Okay, try to understand, there is a frequency of the impulses. Sometimes the frequency is low, as I told you, during the sleep. Sometimes the frequency is high during the running, or during the walk, or when you consume the coffee, or when you consume some other drug, or whenever, whatever the reason is. So in that cases, the frequency of the impulse will increase. So we just capture that impulses from the body, majorly from the thoracic region, cardiothoracic region, and those will be converted into the waves, and those waves are known as ECG. Understand, those waves are known as ECG. And the imbalances, or whatever the imbalances in the impulses you note, okay, or whatever the impulses or these waves, whatever the imbalances in the waves you note down, that is called as the condition, right? So how usually it happens? Either that is because of the sympathetic nervous system or other things, or maybe because of the injury in the heart muscles, or maybe blockage of these bundle blocks. I mean, it could be anything, so those disease and problems we'll discuss in the further classes, but that's how we do the ECG. So look at this, they have again telling the same thing. So sinoatrial node is also referred as the pacemaker of the heart, coordinates the heart contractions, and located in the upper wall of the right atrium. It generates the nerve impulses that travel throughout the heart wall, causing both atria to contract, right? And then automatic nervous system controls how fast or slow your SA node sends the electric signals. Understand the same thing what I was telling in the last class. Last slide. This part of the nervous system directs the hormones that control your heart based on whatever you are doing. Example, your heart rate increases during the exercises and slow when you are sleeping, right? So what are the automatic nervous system? Autonomous nervous system includes sympathetic nervous system, which helps SA node work faster, and then parasympathetic nervous system, which helps SA node work slower. Okay, guys, understand. And then AV node is like it generates the impulses. It catches the impulses which are generated by the SA node and reaching to the AV node, and then there is a delay of 0.1 second, as I told, that 1/10 of a second, and then this is the exact time. This is the exact time. The delay ensures that your atria are completely empty, and the all blood has gone to the ventricle. Okay, that's why this pause is, and then it circulates these impulses to the further parts, and then it goes to the left ventricle, and left ventricle contracts. So this is the complete direction and complete process, okay, of understanding, right? And then bundle of bundle of His or atrioventricular bundle, which is again divides into the left bundle branch and right bundle branches. Okay, you must have seen the left bundle branch block, right bundle branch block. That is because of the injuries, some drugs, or weakening of the nerves. There are multiple things what you are going to learn. And then Purkinje's fibers. Purkinje's fibers are the specialized branches of the nerve cells, and these are making the myocardium work for the contraction. Okay, myocardium means the muscular part, the middle part of the cardiac wall. Understand, right, guys? So this is again the same thing. Here they are telling with the right atrium, and that's how the work cardiac conduction system. So the same thing, from the SA node, the signal circulation from SA node to AV node, and from AV node to the right and left side, and from that it will go to the Purkinje's fibers and make the right ventricle or left ventricle contraction or relaxed, right? So that's all for today's class, guys, the basic part. And in next class, Friday's class, I'll be taking you through the how exactly the heart beats, and it goes with the myocardial action potential curve. So we'll be studying about the phase 0, phase 1, phase 2, phase 3, phase 4. There are 5 phases, and then you will be seeing the ECG, as you can see here, ECG. Okay, so there are multiple things what we are going to learn in the next classes, right, guys? So that's all for today. Now I'll be taking your questions. Please ask your questions, guys, if you have any questions from today's class. Yes, guys. Any questions from today's class, guys? Triangle of Koch, I'll explain in the next class. I'll explain that triangle of Koch. That's why I did not go to that in detail. I'll explain that triangle of Koch. Which textbook we refer to? I'll share some textbooks. I have some textbooks, so I'll share those with you. But those are literally advanced level, so you just have to read the basics for that. Okay, I'll share the books with you, and some data also. Some kind of notes also. We have the old notes, so we'll share with you guys. Okay. See this, I'll make it very easy for all of you. You don't have to worry about. Okay. Right. Okay, guys. So take care, and we'll see you on the Friday. Okay, every Friday there will be classes. Right. So take care, guys. Have a good day. Bye. See you. Thank you, guys. Thank you very much. Thank you. Thank you. Thanks a lot.